All right, so today we are going to be priming a primary gravity IV tubing set. So this is not what you would use in an IV pump, it's just for gravity. So I have a liter of fluids here. We're going to use 0.9 sodium chloride, and then I have my primary IV set for gravity. This is a 15 drop factor tubing. You'll find that in the little droplet on the label. So I'm going to remove this from the packaging, set that aside, and we'll untangle it so it's easier to work with. As I'm untangling this, I'm going to clamp the slide clamp, and then I'm also going to clamp the roller clamp. So I'll have both of those blocked so that when I spike my bag, I don't have fluid going into the tubing right away. I'm going to have a basin here, and for now I'm just going to set the rest of my tubing in that basin to collect what comes out. So I'm going to remove the stopper here horizontally so I don't cross over the exposed part of the bag. I'll set that aside, and next I'm going to remove the cap on my spike set. So I'm going to spike the bag, meaning I'm inserting the tubing into the bag itself in a downward motion. You want to be careful that you don't spike this little area of the bag. So you're going to insert that until it gets to the notch right about there, and I'm going to invert the bag and hang this on my IV pole. Just like that. So next is I'm going to squeeze this drip chamber until I meet about halfway. So there's a little line there. I'm just going to squeeze to fill that up so that I'm not just dragging air through here. So I'm going to undo my slide clamp, and I'm going to slowly unroll my roller clamp so that the fluid will start to travel down the tubing. So I'm going to prime until the first clave. So priming means we're letting the fluid go through the tubing, and I'm going just beyond this first clave, which is right here. So I'm going to set that down, and I'm going to invert it, and I'm going to tap the air bubbles out of here. This is important because we don't want to give any air bubbles to our patient, and if we had to give some sort of IV push medication through this site and we didn't prime, then air could go into the IV, and that could be very dangerous for the patient. So I have all the air bubbles out. I'm going to leave this inverted, and I'm going to undo my roller clamp again. And we're letting it prime, letting it go, just following the air bubbles here. We don't mind those little champagne bubbles, but once they get to be, larger than 1 millimeter, 2 millimeters, that's when we want to tap those out. So slowly letting this go. And if you can see, my fluid is making its way right here. Priming just beyond the clave, I'm inverting it, and I'm going to tap my bubbles out. So you don't want to hold your tubing so tight that nothing moves at all, because we want that vibration to help move the air bubbles out of those little spaces. So I have my bubbles out. I'm going to undo my clamp, and I'll let the fluid continue pushing those air bubbles to the end. All right, and I can leave this cap on. They are designed for the fluid to just continue pushing past that, so you don't have to open it up and expose the end of the tubing. So now that I have it all primed and I got the air bubbles out of the claves, I'm gonna do one last pass. So I'm gonna keep my eyes at the top here, and I'm just looking for any air bubbles. I'm working my way down. If I see any, I'm just gonna tap them along so that the fluid keeps pushing them towards the end of my tubing so we can expel the air. And we just keep on tapping and tapping. And this does take a couple of minutes, typically. And this looks pretty good now. So our tubing is primed, and then I would be able to hook this up to the patient.